Welcome, my name's Bernard and I'm here to talk to you about OCDs, Obsessive Compulsive Disorders. What are they? How do they work? Why do I have this? Is it obsessive for somebody to check that they've got their keys? No, of course it's not. It's a perfectly natural, normal thing. But what about if you're going back to the door 10 or 15 times, or having to walk off and come back again just to check? And you're doing that all the time. And the more anxious you get, the more you seem to cycle around doing that. So an obsessive compulsive disorder is something that we instinctually have learned to do, but has got out of control in a cyclical mode. In other words, there's nothing wrong with you. It's the way we learn what is safe and helps us to survive. Checking to see that we've got the keys is part of a survival thing. Have we got what we need? Checking the door 10 or 15 times is the same thing, but it's out of control. And of course, the more anxious we get, the more entrenched we become within this cycle. So it's things that we do quite automatically that we don't seem to have any control over. We just feel compelled to do them. So there are actually two parts to this. There's something that's triggering that, a belief deeply within us, and very often we may or may not know what that is, but it's there and it's part of you, and it's your unconscious wanting to keep you safe, and that's its job. But it's not functioning properly for you anymore. It isn't achieving the purpose that it's designed to achieve. It may just be something that is a coping mechanism. But what I do know is that you have all that information within you, not me, because you're the expert on you. My expertise is in a different area. I'm a clinical hypnotherapist, a psychotherapist, and a mindfulness teacher. And what we do is form a partnership to help you resolve those issues. So in the first instance, I'll be giving you some really useful tools to help you bring some control back into your life, while we take a closer look. And then those triggers will be collapsed. And once that happens and your unconscious now understands that this cycle of behaviour isn't relevant for you, then it will naturally resolve itself. We're just left with a habit that we just will dissolve. So thank you for listening to me. I hope that's given you a little bit of a better insight. But my contact details are on the website. Have a look, give me a ring, and perhaps we can have a little chat about your situation and your circumstances, just to give you a better understanding. Thank you.